Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them faster than a falcon dive. This clip explains the Reoviridae, a group of double-stranded RNA viruses. Try these cues before we start. Which human reovirus typically causes a self-limited illness? Which one can cause meningitis? Which one is most associated with severe dehydration in infants and young children? Let's start. All human reoviruses are non-enveloped with segmented double-stranded RNA genomes, making them environmentally stable and capable of mixing their gene segments. This gene reassortment gives rise to new viruses that can evade immunity. Rotavirus has a triple-layered capsid, which helps it survive stomach acid and attach to intestinal cells. Its non-structural protein 4 acts as an enterotoxin causing diarrhea. Villus destruction damages the intestinal lining. Malabsorption leads to fluid loss and dehydration. Together, these virulence factors drive the severe watery diarrhea seen in rotavirus infections. The disease spreads when a virus in an infected person's feces contaminates hands, food, water, or surfaces, then is ingested, causing intestinal infection, what's known as fecal-oral contact. Rotavirus most severely affects infants and young children, particularly those who are unvaccinated or have limited access to adequate hydration. After 1 to 3 days of incubation, mild fever and irritability appear. Watery diarrhea and vomiting usually start within the first day and last 3 to 8 days. Severe dehydration, potentially leading to shock and death, can occur in infants and young children, especially if unvaccinated or malnourished. Diagnosis of rotavirus is based on symptoms and physical examination. Stool antigen testing or polymerase chain reaction is used mainly in severe or outbreak cases. Next, Mammalian Orthoreovirus has a double-layered capsid. It's icosahedral with 10 genome segments. It spreads via respiratory droplets or fecal-oral contact, but causes only minor damage to infected gut cells. Incubation is 1 to 4 days, after which most people, regardless of age, are asymptomatic or have a mild illness. Mild upper respiratory or gastrointestinal symptoms appear, such as runny nose, sore throat, diarrhea, or nausea, usually within 1 to 2 days, and resolve quickly. Illness is typically short, rarely causing complications. Hospitalization or severe outcomes are uncommon. Mammalian Orthoreovirus rarely needs identification, as infections are usually mild, self-limited, and require only supportive care. Testing is mostly useful for research or tracking outbreaks, not for treating patients. Next, the Colorado tick fever virus, aka Coltivirus, has 12 genome segments and a triple-layered capsid. It multiplies in developing red blood cells, prolonging its presence in the blood. It's transmitted by dermacenter tick bites, mainly affecting campers, hikers, and rural residents in the western US and Canada. After a 3 to 6 day incubation, fever appears, briefly subsides, then returns. Other common symptoms include headache, muscle aches, and fatigue. Rarely, meningitis or encephalitis may occur as complications, presenting with neck stiffness, confusion, or severe headache. However, most Coltivirus infections resolve spontaneously, and serious complications are uncommon. Coltivirus symptoms are nonspecific and can mimic other illnesses. Lab testing, such as reverse transcription polymerase chain reaction or serology, is necessary to rule out treatable causes when meningitis or encephalitis is suspected. None of these human reoviruses is linked to causing cancer. However, Mammalian Orthoreovirus has been studied as an oncolytic virus to kill cancer cells. Treatment for all human reoviruses is supportive. Rotavirus requires oral or IV fluids to prevent dehydration. Mammalian Orthoreovirus and Coltivirus generally need rest, hydration, fever control, and symptom relief. Prevention depends on the transmission route. Rotavirus is prevented with a live oral vaccine and good hygiene. Mammalian Orthoreovirus spread is controlled with hand washing and general hygiene. Coltivirus infection is minimized by avoiding tick bites, using protective clothing, and checking for ticks. Let's review. Which human reovirus typically causes a self-limited illness? Answer: Mammalian Orthoreovirus. Which one can cause meningitis? Answer: Coltivirus. Which one is most associated with severe dehydration in infants and young children? Answer: Rotavirus. All correct. Clutch. If this clip helped you, like, share, and tap subscribe. Check out the summary table in the description. Thanks for watching. Stay tuned to Med in 5.